Welcome to another segment of ACRP TV. Today, our spotlight is on mining EHR data to determine study feasibility. And our guest is Cynthia Senerchia, who's the Vice President of Data Management and Analytics with OPTUM. Cynthia, thank you so much for joining us first off.
Oh, thank you for having me.
Now let's talk about this. Yeah, absolutely. I mean, study feasibility is a pretty obvious thing. If you don't get it right, you're in serious trouble. You're kind of doomed from the beginning, right? So talk about, as we said, the title of this is mining EHR data to determine study feasibility. So give us some ideas about how it can help one to do that.
Sure. Yeah. So here at OPTUM, we've been working with a lot of healthcare organizations who are working with us for different reasons. And we realized that we have access to de-identified electronic health records from over 100 million patients across the United States. So we have a huge data set. And some of our sites do research, and we know that finding the right patients for the right trials is complicated now, in particular because the eligibility criteria have gotten so complicated. So we've been helping our groups find patients by creating algorithms in their EHR data to identify patients that might be eligible. And what we've determined by looking at multiple different protocols is that, some protocols are fairly easy. Those are mostly that are focused on perhaps post-marketing surveillance or real-world evidence types of trials, which we can probably get almost every single eligibility criteria from the EHR data.
So Cynthia, you've seen, I'm sure, Tufts and other studies that trials continue to get more and more complex. I mean, it's just the trajectory. And I would think getting this right is even more important now and will continue to be more important as trials, I hate to say inevitably, but probably continue to become more and more complex as there are more demands in protocol and data endpoints, et cetera.
Right, I agree. Yes, the complexity is getting worse and worse. We've just reviewed one protocol that had 45 exclusion criteria. So trying to do that from looking at a medical record is very difficult. I mean, trying to figure out if somebody has this exclusion criteria, but not that exclusion criteria, can be overwhelming to the clinical research staff who are also having to do other things like take care of patients and see patients coming in for visits.
Now, before I let you go, I want to ask you a little bit more about sort of the carrot and the stick, because this is hard to do, obviously. But talk to our audience about why it's so important to get this right and what are some of the benefits of doing this properly and doing this work. It's worth it at the outset, I think, right?
Oh, absolutely. So when you're given a protocol by a life sciences customer, you're sort of asked to commit to how many patients you can enroll in the study. So, sometimes when you're thinking about how many patients I have that meet these criteria, you might remember those 5 patients in your brain because you knew them. But if you're looking at all of the exclusion criteria for a study, you may not consider that when you think, oh, this person has cardiomyopathy, so they must be eligible. So we've had some sites come to us, after our work and realize that they committed to doing 20 patients for the entire study, and they only found 2. So, it's a lose-lose for everybody because the sponsor has to get the site started up. That costs money. You have to just get yourself started up. And if you don't really have the patient population to meet that requirement, nobody's going to be happy.
Absolutely. Very timely, very good advice. Well, thank you so much for joining us today. This has been our ACRP TV spotlight on mining EHR data to determine study feasibility. We've been speaking with Cynthia Senerchia, Vice President of Data Management and Analytics at OPTUM. Cynthia, once again, thank you so much for joining us today.
My pleasure. Thank you.